Okay, so good evening, everyone. My name is Lisa Lorraine. I work at the Jubilee Association of Maryland. We are a service provider for the Developmental Disabilities Administration, which is a state agency under the Maryland Department of Health. But we have a specific program called Breaking Barriers to help people in Montgomery County access services. Specifically folks who have traditionally been underserved by the state agencies and other organizations that provide services to people with special needs, people with disabilities. So my job actually is to help any of you individually, one-on-one, to understand how services can work in the county or in the state, and to help you understand the steps to access services. So please feel free to reach out. You'll get my contact information through the presentation. And I also shared the presentation with Kate, so she can email it to you later. So tonight I'm just going to kind of go through some of the services that I think could be important to some of you, knowing that you probably have children of different ages. Some may be pretty young, but others may be getting towards adulthood or even adults. Okay. So before I start the presentation, it's really important to know that you are the person that knows your child the best. And, you may interact with professionals in the system that know a lot of medical jargon or terminology, but even though they may have that knowledge, they don't know your child. And so it's really important for you always to, be able to share the needs and voice of your child. So trust your instincts. Don't be afraid to speak up. Ask, always ask questions when you feel like you don't have the information that you need. So for the very young children, I didn't put 0 to 3 on this, but it is in the presentation that Kate will send you later on, because we have a great infants and toddlers program for ages 0 to 3. But for ages 3 to 5, there's a couple of special programs like MCPS's preschool education program, or in Prince George's County, the early childhood centers, and then in-home therapies like ABA, speech therapy, occupational therapy, physical therapy may be available depending on your child's health insurance coverage. But I did want to tell you more about Montgomery County's My Turn program. So this is only available to people in Montgomery County. It's a referral service that the county runs. So it's like an information and referral service for people with children with developmental disabilities for their families, actually for ages 3 to 13. But they also provide funding for recreational programs, so things like swim classes, karate classes, and they're connected with providers, so people that provide those classes that have worked with kids with disabilities. And they can also sometimes provide summer camp or spring break camp funding. So it's good to know about that program in case you're ever looking for additional funds so that your child can attend a class or a camp. Purely recreational, but with support for kids with disabilities. So getting into the school-based services, again, those out-of-school therapies are still important, right? Inside school, so when your child is receiving special education services, the therapies that they might receive, like speech or occupational therapy, are focused on school skills, so skills that the child really needs in school. So it's important to also get those therapies, if needed, outside of the home, right? Outside of school. Because then those outside of school therapies will focus on, independent living, right? Or life in general, not just school life. And they could be of extra support to the child. Parents Place of Maryland is the statewide parent information and training center. So they're a federally funded organization that provides resources to families of children with disabilities. Both the resources have to do both with education, so special education, your rights, how to advocate for your child, how to understand the IEP. And then they also provide resources for accessing medical care for children with disabilities. So if you're having a hard time accessing certain services or treatments, medical treatments for your child, or medical equipment or supplies, Parents Place of Maryland can give you one-on-one guidance. And then they also have lots of general resources as well. So you'll get the link, through the presentation, but if you contact them, you can even request that they read your child's IEP and maybe the most recent psychological evaluation that was done in the school, and they will actually help you understand what does the IEP say, and then you can talk to them about your concerns or what you're hoping for your child in school, and they can help guide you to ask for things in the IEP meeting, or to help you advocate for your child in the IEP meeting. They won't attend the IEP meeting with you, but they'll be able to give you pointers to use in the IEP meeting. There's also a listserv in Montgomery County, but there's also lots of people from outside of Montgomery County on that listserv. It's called the MC Needs listserv. And it's focused on, school-age children, younger, probably till like age 14, 15, because there's a different listserv for the transition-aged children. Transition being the time period when kids are starting to get ready to leave school and have their lives as adults. So the MC Needs is focused on kind of 14 and under probably, and then MC transitions for 14 and then through adulthood. And I have the MC transitions link on a different page. But I think this listserv is really great because people post a lot of information about resources that are available. And then you can also ask questions there. So if you're looking for like a Medicaid provider of ABA services that speaks Chinese, it would be a great place to post that question and see if anyone can give you, some assistance with that. And actually, Medicaid does have a list of languages spoken by different ABA providers. So if you're looking for that, I can help you find that as well. Okay, so now going to the teen and young adult services. When your child is in high school, and in Maryland at age 14, your child will start to have a section of the IEP for transition. So the teachers should be asking your child and talking to your child about what they might want to do after they leave high school. What type of career they might want to have, or if not a career, what interests do they have, and what skills might help them in their life after high school. And on the IEP, they should have goals that, the school will actually help them work on to transition to adulthood. So those could be very specific goals. For example, if the person wants to become, maybe has a career goal to work with animals, right? Then the transition goal on the IEP could be that the student will be able to identify 5 different jobs that work with animals and maybe also be able to say what skills are needed to have those jobs, or what type of preparation is needed to get those jobs. So that's just an example of the type of goal that you could have on the IEP. You could also have more general goals, like, the student will be able to identify activities that they enjoy outside of school and plan for how to, be successful in those activities. So that's more of like a social life goal, right? Because not everything about life after high school is about a job, right? We need to have very meaningful social lives, right? And that can be hard for some kids. So you can think about any area of life as an adult, that could be part of the transition plan on the IEP. So it's important for you to know that you can help direct those goals depending on what you think is going to be important for your child after high school, the non-academic things, right? So, each Montgomery County public school has a transition support teacher. And then some of the special programs, like the Learning for Independence program, they may have their own specific transition teacher. And that teacher will help you understand what services can be available to your student after high school. And they will help you apply for those services also. So for example, my agency, Jubilee, provides the services that are funded by the Developmental Disabilities Administration, DDA. So your transition teacher can help you understand the process to apply to DDA, and then eventually how to get into services with DDA, and what types of services are available, what types of services would be a good match for your student. So it's important. The process can be very complex. So even though you think age 14 might be very early to think about adult life, especially if your student is going to stay in school until age 21, it's important to be learning little by little along the way, age 14, 15, 16. Attend the information sessions that are offered by the school system, or even contact the transition support teacher directly and have a phone call with them or have a meeting with them, and just ask whatever questions you have. Like, what do you need to be doing to prepare for adult life, right? The transition teachers are really great. I've worked with many of them, and they're really, really wonderful people. They work really hard for the kids, but they have big caseloads. So they might not always reach out to you individually, so make sure you reach out to them if you need them. Another agency that provides services to many people with disabilities, adults, is the Division of Rehabilitation Services, or DOORS, and they provide short-term employment services. And by short-term, it's very flexible, because for some people it's going to take a much longer time, maybe years, to get a job and be successful at keeping that job. And for others, it might just take a couple of months. So they have a big variety of services to be able to support people through that process. I recently learned that they can help adults modify or get a car and modify the car so that they're able to drive it if, for example, they can't use their legs to drive it, because using a car may be something that they need to get to their job, right? So they have so many different services related to helping make sure that you can be successful in getting, keep getting and keeping a job. In high school, kids are also eligible for what they call the pre-ETS services, the pre-employment transition services. So if you're interested in it could be like an after school once a week for an hour or two Sometimes they have it on the weekend or in the summer. They offer different types of programs for high school students to start exploring careers and gaining skills that will help them once they leave high school. So you can apply for those anytime the child is already in high school. And then the last one listed, of course, is that MC Transitions listserv, but I also wanted to mention that Potomac Community Resources, or PCR, has a webinar series. It's pretty much monthly, although I think they may take a break in the summertime, where they offer really good programs about transition. So learning to help you learn about what might be needed when your child leaves high school. So they have things on Social Security, they have things on employment and doors, they have things on social life. They have tons of programming, lots of really good programming. So I just recommend that you get on their email list and make sure you get notification about those programs. Okay, so in school, students have a right to receive special education services if they're needed, right? So they have a right to receive speech therapy if it's needed, or special classroom, or a certain teacher to student ratio, right? Depending on the student's needs. But when a student ages out of the school system, it's no longer, you don't have a right to any service. So it's important that you understand how the process to access services works, so that you're making sure that the child can be eligible as an adult for those services, and that they take advantage of any ways to access the services. So for example, the DDA, the Developmental Disabilities Administration, prioritizes students leaving school at age 21 for DDA services, but they only prioritize students for 1 year. So if you get into service during that time, from age 21 to 22, or the year after you leave high school, you can keep those services for life. You can start the DDA services, and as long as you stay Medicaid eligible, you can keep those services for life. But if you don't access the services by the time 1 year has passed, they will then put you at the bottom of the wait list. And they prioritize the rest of the wait list by crisis situation. So it's likely that the person would not receive any DDA services until they were in a crisis situation, like at risk of homelessness, their caregiver is very elderly or maybe passed away, or they have dangerous medical condition, that is dangerous to them if they don't get the support to control it, or something like that. So, for out of school services, so after the student is leaving school, it's important to stay on top of the processes so that you don't miss out on accessing services, that might not be available to you at another time, or if you don't have the right documents, or, whatever the situation could be. Okay. Kate, how am I doing on time? Can I go for 5 more minutes, do you think? Okay. So these are some programs that are available to everyone. The first one is just for Montgomery County, but I think the rest of them are all statewide programs. So in Montgomery County, we have special funding for respite coordination that is run through the ARC Montgomery County. And respite provides a break to the caregiver, the primary caregiver. However, the way that that is provided could be services for the individual with the disability. So it could be a recreational program. There's some great organizations that have these like weekend programs, like a Saturday or a Sunday. I think one of them, they're like going to the zoo together. Another one, maybe they like go out and do a walk in nature, you know. So they have different types of programming. You can also get the services in your home. So a personal care person can come to your home and like an aide and help support your child or your adult child with a disability also, while you know, take care of your household errands, or you could even be in the house, but doing things, you know, maybe you need to do some work on the computer or something, right? So it's a way to just get some extra services, either in home or out of home through the county. So it's good to know about that program. And the ARC, the staff at the ARC is really very helpful, and they want to make sure that you can access the services. So if you reach out to them directly, they will definitely explain everything that you need to know. That program, you do have to reapply every year, and they go by the county's fiscal year starting in July. So it's July through June. The second program listed that I wanted to share about is the Low Intensity Support Services. This is a DDA program, the Developmental Disabilities Administration program, for people who are not receiving DDA services. They have an annual lottery selection process. So you can actually, it's open right now. So if you click on that link, you should be able to find the link to enter your child's name in the lottery. And if selected, they will send you a letter to your home, and you can choose up to $2,000 of supports or services or equipment needed for your child because of their disability. It can't just be like anything you want. Sometimes there is documentation required. So for example, if I have someone who's using the money for hippotherapy, which is occupational therapy received through horseback riding. So in that case, there's specific documentation needed from the OT, for example, and there might be some other documentation needed. But if you're selected, you know, as long as you can provide that documentation, they will pay for the services. In addition, Disability Rights Maryland is a legal organization that can help with legal cases when people's rights have been violated. I'm currently working with a family that is going to appeal their DDA decision with the support of Disability Rights Maryland. So depending on what your case is, they might be able to help you. They also take education, I believe they take education cases. Yes, they do, for special education services. It's really important to become better advocates for ourselves, for our children, and for our children to become better advocates. And the ARC Maryland has a program for advocacy. And then finally, if the child is uninsured or underinsured, it might be possible to access the Maryland Children's Medical Services Program to get additional services. Some private insurances might not cover things like speech therapy and OT, so you know, you might be able to access this program for that. And then there are some specific organizations that you should connect with if your child has, you know, Down syndrome, autism, or mental and behavioral health concerns. And then I just put a little bit information about government benefits here. And of course, Social Security, SSI, the Supplemental Security Income Benefit, is available to some children if their parents have, you know, a lower income or lower assets, right? So when you apply for SSI for a child, they take into account the parent's income, and that could disqualify some children, right? But as soon as the child turns 18, it's based on their own income. So they, you know, typically students will become eligible for SSI benefits when they turn 18. Medicaid has some special programs. So one is Community First Choice Program, which provides personal care assistance in your home. And then DDA and the Autism Waiver Program are Medicaid waiver programs. So a Medicaid waiver is that the federal government has given special like allowances to the state to provide special services, additional services that are not normally covered by Medicaid to specific populations of people. So in this case, children with autism, or for DDA, people with developmental disabilities. So the autism waiver is available for people from 0 to age 21. There's currently around an 8 or 9 year wait list for that. However, the state has recently passed legislation that should speed up the timeline. So we're expecting that more people will get called off of the autism waiver registry, but we don't know if the system has enough providers to actually provide the services. So if you are called in from the autism waiver registry, that's great news, but you should know that it could be frustrating to try to find the providers. And so please have some patience as you know, the whole state of Maryland is adjusting to this. You know, you may need to have patience in trying to find the right provider, or a provider that can care for, you know, provide the needs. Okay, I know I'm going like way over, so I'm going to try to stop, but I have some other links here that could be helpful to you. And if you ever want to talk about any of these, feel free to contact me and I can give you more information as well. And then I wanted to let you know that Breaking Barriers, my program, will be at the AAPI Heritage Month celebration that's being put on by the county. That's Sunday, May 21st from 11 to 4 at Seneca Valley High School. So please come join us. I'm sure there's going to be tons of performances, crafts, lots of resource providers as well. And you know, here's my contact information. I'll put it in the chat, so feel free to take it down and contact me at any time about any question that you have. And I think that's it. I don't know if we have time for questions, Kate, but
just one question on the chat box. As a parent asks, how do you define needs for special special needs? If a child is in the private school system, how does she like satisfy the criteria?
Students receiving, so that's a great question that I don't know that I have the answer to. Okay. Right.
So I was like also hesitate to type in anything because
I don't know if Veronica might be better at answering that. I don't know if you know the rights for the private school students. I'm not sure.
Yeah, I don't have the clear answer either, especially I'm relatively new to the Maryland area, but in the Illinois state, I also had a couple teachers who had questions working in a private preschool setting where they, you know, it's not the formal IEP or the 504 that we see in the public school setting. So yeah, the answer is no, I'm not sure, but my understanding is that like a different
right.
Yeah. The 504 is I think an ADA related, it's related to the ADA law. So I'm pretty sure that schools would have to be able to do a 504, meaning any accommodations needed to help the student access the school environment because of their disability should be accommodated for. But IEPs, I think, only protect you in public or only required in public schools. So I don't know, you know, maybe some private schools may have their own plans that they create, I'm guessing, but they're not required to, I don't think, provide the services if they don't have them.
Right. I can speak a little bit about this. So there's multiple models for service delivery. and eligibility for services. So in a public school, and every public school, every child is afforded the right to a free and appropriate public education. And so the ADA is the Americans with Disabilities Act. And so under this, anyone in a public school who has difficulty accessing their education or participating in their education because of some sort of need or disability, they can have a 504 or individualized education plan or IEP plan. So those students, I think under this would definitely qualify as special education. Private schools, like Lisa was saying, they are not required to provide services to children with a disability. However, they can receive services through a county resource. For example, preschoolers in a, you know, or anyone like early education in a private school can have a Montgomery County or any county itinerant therapist working through the Birth to 3 program come to their program. So it could be a private preschool. They can have an itinerant speech therapist, for example, come to their program. That's a county program. They can also use sources through their health insurance to come to the school. So I work at an outpatient clinic, and in the medical model, it's sort of a not great model. It's a deficit model. So if you test below certain norms, then you're eligible for, you know, and your insurance company approves that you're eligible for therapy. So you might be eligible for occupational therapy, physical therapy, or speech therapy as an example. And you can have reimbursement through your health insurance. So for example, I have provided as a speech therapist services in a private school, but the funding is from the child's health insurance. So I think as under, you know, if you qualify under the medical model or the educational model as a child with a disability or as someone who needs special education services, I assume both would be fine.
Right.
Because that child would have in a private school, that child would have qualified for services in a public school. I don't know what Kate wants to say.
Right. So yeah, it's a very never really think about that direction. But I think if you have some third-party evaluation by a developmental specialist, and if you have a diagnosis, I believe you can still use all kinds of service that is provided outside of the public school system. For example, the autism waiver program, right? Anyone can get on the list as long as you have a diagnosis, right? And yeah, so like DDA, it's you don't need to go through the public school system to get on it. Okay, great. Thank you, Lisa. And I know you will share your slides so that I can share with anyone who is here who do not receive my email and you want the slides. Please leave your email here and make sure I'll email the presentation back to you. The nice thing about Lisa's presentation is that she always like insert the link to all the programs in her slides, so you can whatever program interests you, you can just click on it and it take you to the program. Okay, thank you so much. And I also record this and I'm going to share with the WeChat group. And so hopefully, I mean, I know I need to go back to it again and again because it's like, I think the